Hi, I want to take a minute today and talk to you about what I like to call the family drama effect. And that is arguing in front of a patient or even with a patient, which is even worse. So, the first thing I want you to do is think about something that you may have been through. Maybe you were invited over to somebody's house, or you've been invited out to dinner with friends, and your hosts begin to argue, and they're arguing about something that doesn't necessarily have anything to do with you, where you would interject in the argument, but it's making it so uncomfortable where you want to disappear from the table, but you're at their home or been invited to a dinner party with them, and you can't get up and leave. The tension is palpable. It makes you so uncomfortable. You don't know what to do, and there's no escape. Now, put yourself in a bed in a hospital or on an exam table, and two colleagues begin to argue about either your care or some personal disagreement. It becomes so uncomfortable for them. They are captive. They can't get up and move. It begins to affect their confidence in their care, their trust, and gives them a poor patient experience. There is no room for the care team to argue in front of a patient, or even in an area where a patient or their family could overhear. You can't allow that tension to come into their hospital room or exam room and disrupt their experience and what they're going through. So there is absolutely no room. There's no excuse for arguing in front of patients. If you have a disagreement or a concern, when you leave that room, ask the person to step aside, and out of any possibility that a patient or family member could hear, talk about it. Resolve the issue, express your concern, let them tell you why they feel the way they do, and come to a conclusion and come to an agreement. But please, under no circumstances is it allowable for you to argue in front of a patient. We save the drama for outside of this organization. And please remember, our patients are our top priority. We want them confident in us. We want them to trust us. We want to give them the best care that we can. And I know you can all do it. Thanks so much.